Continuing to support appropriate care in the community is an important focus for the LHIN as a way to provide better care to patients and reduce overuse of the hospital system. A shortage of family doctors and too few chronic care beds are just two of the many issues hospitals face in the delivery of acute medical care.
One of the biggest issues facing hospitals right now is capacity and the ability to meet everyone's needs that comes to the door.
Our job is to look after the acute phase of their care, but if no one else is picking up on the chronic phases, then we feel obliged to continue to look after that.
We're just opening a satellite health center here in the Sarnia area now, and we're finding that many of the clients that we are bringing into our practice have been relying on the hospital emergency department for their primary care over the last while. We hope that models such as Community Health Center, the new family health team that's currently under development here, can take some of that burden off.
Locally, with our shortage of primary care, there is a tendency for the population to look for care where they can find it, and the hospital is an obvious place.
Traditionally, hospitals are the beacon in the night. They're the ones that are open 24/7. They're the ones that have whatever services generally are needed. And that has contributed to, I think, an idea that if you have a problem, the hospital's the place to go.
We've had situations this past fiscal year where we've been over capacity. You know, if you subscribe to the philosophy behind the LHIN and you take a step back and look at the LHIN-wide benefits we enjoy, but certainly some of the challenges, and the challenges are, how do we get people to use services effectively?
To address the overuse of the hospital system, it may be necessary to understand people's behavior when they become sick.
Now that things are starting to change, we have to go back and revisit how people behave when they feel ill, and then really decide what the real use of hospitals should be.
I fully agree that a hospital should do what it could do best. So that is what previously talked about. The LHIN should realign resources.
With the physicians that I currently work with, there's a lot of burnout going on and a lot of pressure to be the one provider that provides everything, and the reality is they can't. And so when you have a multidisciplinary team approach, you have the primary health care nurse practitioner that addresses certain issues, that works collaboratively with the physician. You have registered dietitians that help with dietary needs. You have social works that helps with some of the social issues. So it does take the stress off a lot of our frontline healthcare providers.
But it is clear that fixing the system will be a challenge.
The problem is the demands far exceeds the current resources because the hospitals are limited as what they can provide.
Hospital-based services are the most complex and most expensive to provide.
We're quite good at providing medical care and acute treatment and the continuing medical care and treatment that's required in the home, and we do provide a certain level of services for personal care. But I think we really need to improve that and increase it so that we do keep people out of hospitals.
Reducing dependence on hospital-based care requires continued investment in the many community-based resources available to patients and their families.
We know that we have the resources and the technology to deliver effective community-based care much more cost-effectively.
Today we find many people throughout our communities gravitate towards the hospital as the one center to fix everything. This is an issue with respect to lack of primary care in our region as well, where people will tend to go to the hospital. We have to find new ways to accomplish this, and that's through family health teams and community health centers.